It's Patrick Hutzel from intensivcarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from our clients and readers, and the question last week was part 3 of my husband had open heart surgery with complications. He's not waking up, he needs 100% of oxygen and now he's bleeding from the stomach. I'm so scared, help. And that was part 3. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to basically answer part 4 of the same question from one of our clients, Katie. And those are excerpts from email counseling and consulting sessions with me. So this week is part 4 of my husband had open heart surgery with complications. He's not waking up. He needs 100% of oxygen and now he's bleeding from the stomach. I'm so scared. Part 4. This was another great series of questions where I was basically able to handhold a very anxious and distressed client through a very stressful and complex situation. So Katie writes, "Hi Patrick, once again thank you for your thoughts and helping me to know and understanding what questions I should be asking concerning my husband's ongoing difficult situation. Believe me, in this last week you have been my source of information and advice, but probably more than anything you have given us hope as a family. For that we're very grateful. Thank you. Yesterday my husband, after 2 open heart surgeries in 3 days, was taken off the ventilator for about 12 hours. He got distressed and they had to put him back in sometimes early in the morning hours. He's back on sedation now and on the ventilator. Such a setback which has left my daughter and me devastated. The ICU person who's taking care of him said it could be weeks and weeks and even months yet in ICU, and they would not be taking the ventilator out anytime soon. I have been in distress ever since. I will go to the hospital, which is an hour away, in the later this morning and make sure I talk to a doctor. My husband will not want to live like this for weeks and weeks. He's the type who always has put his family first and will think he's a burden. He has always been very active. It's so very hard to see him like this, and after actually having him say a few words yesterday when the ventilator was out, we were overjoyed just to be knocked down again. Is there any hope out there? Should we ask for a second look from a different specialist, like second opinion type of thing? Do doctors do that sort of thing? Call more advanced, more perhaps expert people in when they are perhaps perplexed as to what to do next. They also have been saying he has COPD. We never knew that, though he had been diagnosed with exercise-induced asthma and used to use an inhaler before and after he went for runs. No longer uses it as he doesn't run like he used to. Thanks for all your help, from Katie." So here is my response. Hi Katie. I'm very sorry to hear that your husband had to be re-intubated after a failed attempt to get off the ventilator. I would argue that the ICU person has misinformed you about not taking the tube out anytime soon. If your husband needs ongoing mechanical ventilation as a next step, he might need a tracheostomy first. ICU staff, doctors and nurses, are often poor communicators and they can be very quick at painting a doom and gloom picture for a number of reasons without explaining to you in detail what it actually means. Intensive care health professionals, doctors and nurses, tend to be very time poor as it's a very busy, dynamic and volatile place with lots of things happening. They also most likely withhold crucial information from you because they want to stay in control of the outcomes and the meaning. Again, intensive care can also be very dynamic and very volatile. I have seen many patients failing their first attempt to get off the ventilator over the years working in intensive care, And given that you haven't seen this, and given that it's your husband, I can understand your concerns and even that you might panic. Intensive care is often 2 steps forward and 1 step back. One of your biggest assets during this once-in-a-lifetime challenge is to be patient and take 1 day at a time. I know it's easier said than done, but you can't rush recovery from critical illness in intensive care. Your husband will need time to get through this. Panic is the wrong approach. A second opinion might be an option, however, it's most likely too early for a second opinion. Hospitals do that sort of thing, but it might cost you money as well as to get another doctor in. I believe that guiding you to keep asking the right questions is as good or even better as getting a second opinion from another doctor. Doctors tend to cover each other, whereas here at intensivecarehotline.com you get a real independent advocacy service that's truly acting in the best interest of patients and their families. Besides being distressed, have they given you a reason why your husband failed getting off the ventilator? Once you have a reason for the failure, I might be able to share some more insights. Katie, it's also so important that you need to look after yourself during this challenge. You may want to check out an article that I wrote about the 3 most dangerous mistakes that families are making but unaware of if their loved one is critically ill in intensive care. Also, to put things in perspective, I have seen many critically ill patients in intensive care staying there for many weeks in an induced coma and yet still survive. Most critically ill patients in intensive care in an induced coma don't remember much of their stay in ICU. Your husband may thank you one day for not giving up. As you know, life is precious. Moreover, I have put some links below this video to check out the following articles and videos regarding ventilation, breathing tube and tracheostomy, as well as induced coma in intensive care. It'll give you more insights and perspective that you may need in order to deal with this challenge. It's a very good chance your husband will need a tracheostomy as a next step. So the articles and videos that I put below this video, and I put some links in there, are: how long can a breathing tube or an endotracheal tube can stay in? How long should a patient be on a ventilator before having a tracheostomy? And another article and video is: why would a critically ill patient in an induced coma need a tracheostomy in intensive care? Whilst you might feel that this nightmare has been going on for very long, I can't stress enough, Katie, that your husband is only in the beginning of a critical illness. To get him out of intensive care alive might take a little longer than expected. Again, this is all about getting perspective, Katie. To get your husband out of intensive care alive, you will need to give him this more time. 2 open heart surgeries within less than 48 hours is a lot to go through. Therefore, setbacks are almost expected, especially with the stomach and gastrointestinal bleed. Once your husband has a tracheostomy, he will have more time to get off the ventilator in his own time, and it'll be so much easier to wean him off the ventilator. Managing the setbacks is easier as well. Also, take a look at another video and article about what are the risks and benefits of a tracheostomy. Again, I put a link to this article and video below this video in the written version of this blog. So take care, Katie, and look after yourself, and we'll talk again. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.